Hello, everyone. My name is Julia Habu, Nursing Officer, Diff Medical Center. And I have with me here a consultant family physician, Becky Stu certified cognitive behavioral therapist, and a member of the Academy of Cognitive Behavioral Therapists in the person of Dr. Chika Anireto. Now,
Thank you so much for that lovely introduction. Hello, everyone. So to summarize what I do, I'm a family doctor. So it means I take care of patients with medical conditions or issues, and I also take care of the psychological well-being, emotional distress, anxiety, and things like that. And I work at Sunshine Clinics in Deaf Medical Center. Thanks for having me.
thank you. Thank you so much, ma'am. Well, today we're going to be discussing a very, what I call it sensitive now. It's a very important topic. We're going to be discussing self-esteem. Is one topic that's most often misinterpreted, misunderstood across all spheres, across the youths, across adults. It's often misunderstood. And today we have a certified cognitive behavioral therapist who can educate us and teach us better. So today we're going to be asking her a few questions that will help her give us an expose as to what self-esteem really means. So, man, I'm going to start by asking you, from your perspective, what is self-esteem? Give us a broad scale of what self-esteem is and throw in some components there.
All right. Thank you so much, Julia. So self-esteem is your overall assessment of your worth as a person. So your evaluation, what you think about yourself. And it has several components, four actually. So to have healthy self-esteem, you have to believe that you're worthy of self-respect. You have to respect yourself, meaning that you believe that you deserve to be happy and to love, and also that you identity, who you are, your beliefs, your values, what you stand for. And you have to believe that you're capable of withstanding life's difficulties. And finally, you have to have a sense of belonging. Your family, your maybe professional group, your friends group. So if you have all these things, then you have a healthy self-esteem.
So what are the components? You said there are four?
Yeah. Okay, so I'm going to outline them again. So to have the components of self-esteem is that you have self-respect. You believe that you're intrinsically worthy. You have a sense of identity. Some people feel like they're lost. They don't know who they are. They've masked for so long. Masking means put up a facade, wear a mask in front of people so they don't really know who they are, what they stand for, what they believe, what they value. So sense of identity. And then one of the other components is that you have efficacy, self-efficacy, meaning that you believe you're capable. You believe that no matter what happens, you can cope. And then finally, I mentioned sense of belonging, right? So sense of belonging, feeling like you belong, you're accepted, you fit in, you're not weird or different or awkward. So when you see yourself in these ways, you have self-respect, self-efficacy, sense of identity, sense of belonging, then you have a healthy self-esteem.
Thank you so much, Ma. So my number two question will be, why is it important for us to discuss this topic? Why is it important for people to know about what self-esteem is and understand it?
So excellent questions as usual. So this is very important because it is your sense of self-worth that affects how you relate with people. If you don't value yourself, then you tend to shortchange yourself in relationships. You tend to not have boundaries. You tend to not be able to say no or people please. So having a healthy self-esteem is important in your relationships. It's also important in the decisions you make. So if you tend to sabotage, for example, or make decisions that ultimately will be detrimental, will harm you, then it's an indication that maybe it's coming from a place of lack of self-worth. Another reason self-esteem is important is that it gives you an overall sense of well-being. If you value yourself, you're generally happier. Plus, you're able to have resilience. You're able to bounce back from the stresses of life. So it's a huge topic, and it's something I love this forum because it's our opportunity to, first of all, educate people, shine a light on this topic, and also teach people how to buffer up or increase their sense of self-worth.
So, Ma, can you educate us or tell us what the different types of self-esteem is? Because from your definition, you said something about self-worth and all of that, but then we need to know what the different types are because we've heard there's high, there's low, just so many things. Can you please give us a picture.
Alrighty. So you can categorize self-esteem in different ways, but I love the simple classification of having either high or low self-esteem. But the high has two different types. So you can have a high self-esteem, but it's insecure or fragile. So we have a high insecure self-esteem, and then we have a high secure or stable self-esteem, but we have a low self-esteem as well. So if you like, so I should go into the different types, right?
Yes.
Explaining.
Yes.
Thank you. So if you have low self-esteem, it means that you don't value yourself, you don't respect yourself, you don't think you deserve happiness or good things to happen to you. You don't feel a sense of capability, and it's almost like people that have low self-esteem have a tendency to want to wear a mask, pretend in front of people, because they have the sense that who they really are is not acceptable or doesn't meet up to societal standards. So these are a few characteristics of low self-esteem. We'll go into them later into detail, but this is like an overview of what it means. Then if you have a high self-esteem, it could be either fragile or unstable or insecure, like we said. So the difference, so people that have high self-esteem, their self-esteem doesn't depend on anything else. It doesn't depend on their achievements. It doesn't depend on maybe their academics if they're students. It doesn't depend on approval. So high, secure self-esteem, your sense of self-worth comes from within. You know that you're deserving. In that way, when life's difficulties come, it's bothersome, right? But it doesn't shake you terribly because you still are who you are. So failure at something, for those that have high, secure self-esteem, doesn't make them failure as people. Another characteristic that differentiates between high secure and high insecure is that people that have high fragile or insecure, maybe I'll stick to one description, high fragile is the same thing as insecure. People that have that kind of self-esteem, they tend to be quite easily ruffled, like reactive is the word we use. But reactive basically means the tendency to be defensive, not take criticism very easily. So you are very easily upset by criticism or feedback, constructive feedback, because it hurts your sense of self. Whereas if you have a secure, high self-esteem, you take feedback in your stride. You look at it and, okay, it might hurt, but then you realize it doesn't mean something negative about yourself. And then finally, people that have a fragile, high sense of self-esteem, they have what we call narcissistic tendencies. Basically, what that means is the tendency to put on an air of being superior, entitled, better than others, whereas inside they're really vulnerable and don't believe they are worthy. So it's interesting because they, on one hand, they see their achievements and they boast about what they've achieved, but they are reactive because inside they don't really believe that they're worth it. And we'll talk about why. It typically goes back to their childhood. Whereas people that have a secure self-esteem are more authentic. They can come up, be who they are, weaknesses and all, because their weaknesses don't define them or is not like an overall assessment of their worth. So that's some of the differences between having a high fragile versus a high secure self-esteem.
So amongst this, is there a point where we can draw a line and say this is normal? Would we say having a secure high self-esteem should be what normality will be referred as or regarded as?
Absolutely.
Oh,
so that's like the target, what we should have. If we don't have it, then you either have a low self-esteem and then or high fragile. Yes. And then with all the implications that we talked about, decision-making, relationships and things like that.
So next question is, how is self-esteem developed?
Excellent questions as usual. So it's really important to know that self-esteem, first of all, it can be genetically determined. It can be inherited, but not 100%. So about 50% according to research is just what is passed on by your parents. But even the manifestation of this depends on your environment. So environment meaning parenting. For example, so there are 3 different ways we can parent kids. And so this is for all the parents out there or intending parents. we can be either authoritative, which is actually what is desired. Authoritative means you have boundaries, but you're warm. And you have boundaries, don't do this, but when the child would do what you said they shouldn't do, you are able to correct without attacking the child's person. So don't do that, not you idiot and stupid kind of thing. Or I said you shouldn't do this. This is what I want you to do because of whatever, whatever. And not so you point out the flaw and preserve the child's personality. So when you raise a child this way, where you have unconditional positive regard, you love the child regardless, and it shows up in your correcting, where you're not beating down the child's person, you're correcting. So there's a separation between who the child is and what they do. Then you bring up children that have a sense of, I am worthwhile. But when you discipline and you discipline in such a way as to criticize the child's person, what you're saying is that when you don't live up to standard, then you are not up to standard as a person. So that's authoritative parenting. So you have boundaries, but you're warm in the sense that you protect the personality of the child. And you show love and draw the child towards you regardless of what they do. So you're not permissive, which is another kind of parenting where everything goes. You do something wrong, oh, it's okay, love. You make a mistake, it's okay. That's permissive, and that's not helpful either. Neither are you authoritarian, where you want to control every aspect of the child's behavior. And you are very critical. And when you criticize both what was done, the behavior, and the person. So that's the difference. So childhood parenting is a key thing that influences our self-esteem. Sometimes intentionally or unintentionally, parents can overprotect their kids as well. So that's another thing I've seen time and time again, where parents inadvertently bring up kids that have a low sense of self. So as from a parent's perspective, so I'm a parent, right? You might think that, especially in this country where there's a lot of insecurity, that this is the way to go, protect, obviously. But there's a difference between protecting and allowing the child to learn from making reasonable mistakes. Because making mistakes teaches you that I can do it. I'm capable. I can cope with this. But when you step in every time things are difficult and every time there's a stress, to shelter and protect your child from difficulty and stresses, you inadvertently teach this child that you can't cope without me. And then you have kids that have core beliefs, a fundamental belief, an idea about themselves. You inadvertently raise up kids that believe that I need someone to help me. I can't do things by myself. And, also have a sense of I can't cope with this, which is having a low sense of self-esteem. So another thing that can help in the development of self-esteem is achievements and life history. So the things I can't cope based on what you have experienced. So bullying, for instance, at that childhood level when kids are developing. So our sense of who we are develops when we're young, from how we are treated by those who love us or take care of us. That's why parenting has a factor. And those that are in our circle at that age. So if you're bullied as a child, you might grow up with the sense that maybe if the bullying had to do with some facial feature, you might grow up the sense that because I am not beautiful, then I am not good enough, something like that. So traumatic experiences, sexual abuse and things like that. So negative experience can negatively influence our self-esteem, but positive experiences, achievements, especially when they're repetitive, high academic achievements, receiving an award, being good at athletics, or having some skill that separates you from others, definitely also builds high self-esteem. Something else that is responsible for self-esteem is other factors, like having a chronic illness. So if you have like sickle cell disease, for instance, you're always sick. And I'm not even saying this as a rule. This is just like what happens generally. There are a lot of exceptions. I have patients who have sickle cell disease and they believe I can cope. They believe that, you know what, I'm different, but I got this. I can cope with this. So I'm not saying just because you have a chronic illness, you must have low self-esteem. No, I'm just saying these are things that are more likely to tilt you towards having a low self-esteem. And then I want to point out that another thing that influences sense of self is perception, how you see yourself, especially physical attractiveness. So even if maybe by societal standards, you might not be like Miss World, if you believe that you are beautiful, that's what counts. So there's a lot of belief there. So if you believe that I'm pretty, I'm attractive, if you believe that, then your self-esteem is boosted up. If you're beautiful by societal standards and you don't believe that, then your self-esteem is low. So these are the different things that are responsible for building up our sense of self.
Okay, well, so I was going to ask you, but at one point you mentioned how high achievement can affect a person's self-esteem, and self-esteem is something that we related strongly to self-worth and all of that. Am I okay to think that um if a person has consistently attained high highs in life, there's a possibility that they might really not know their self-worth outside winning? For instance, I'm thinking of how to explain it better.
I think I
Like,
understand what you're saying.
is it possible for someone who has had high achievements still have low self-esteem, irrespective of that they might not know because maybe they've not tasted some form of failure?
So I agree. So yes, it is possible for someone who has achieved a lot of things in life to still have low self-esteem. In fact, this is exactly what the high fragile self-esteem is all about, where you have achievements and you have reached a stage in life, maybe in your profession that is enviable, right? You're respected by your peers externally. But perhaps because during childhood, this external achievement was what your worth depended on. Your parents would only praise you when you came back with an A. So you are driven to achieve, but then you don't see yourself as worthy because you didn't have your parents' approval when you didn't get an A. You see what I'm saying? So this combination of, on one hand, you're driven to achieve, on the other hand, you still don't think you're worthy, is exactly what high fragile sense of self-esteem is. And people like this, I said, they have this tendency to be narcissistic where they feel it's superior, entitled, but then they are so dependent on external validation because they have this sense inside, subconsciously, that they are not really worthwhile apart from these achievements. So this is really the making of someone that has a high fragile sense of self, like self-esteem, yes.
Okay, so my next question is going to be focused on the low self-esteem part. So how do we identify, or how does a person know what are the common signs that a person would have or display that will make me and the person know that, oh, I think I have low self-esteem there?
Yeah, so excellent question as usual. So I just want to explain it from a point of view where people understand why it happens like that, so that in your understanding why, you will understand why the symptoms of low self-esteem are that way. So if I believe that I don't matter, I don't deserve happiness or applause or approval, I am going to be so hard on myself. I'm going to push myself because I feel like you need to be excellent. You need to be perfect in order to achieve, to be enough. So one characteristic is self-criticism, being like your worst self-critic. Another characteristic from what I've explained is perfectionism. You feel like if I'm not perfect, then I am not enough. So perfectionism is not a bad thing by itself, but when your perfectionism is a reflection of who you are, so you say, I'm not perfect at my job, and because of that, I am not enough as a person. That's the problem. So because I'm a doctor, right, we are driven, we want to be perfect. You cannot make mistakes with human beings, can you? But if your sense of self is not tied to that, then it's great. You should actually aim to be very, very good. But once you feel like if I'm not perfect in what I do, then I'm not good enough as a person. That's the problem, the linking it to self-worth. Whereas, remember we said earlier that, healthy self-esteem is where your self-worth does not depend on these external things. It's intrinsic, comes from within. So other than that, another telltale sign of low self-esteem is where you're hyper-independent. And this is interesting because our society applauds people that are independent, strong, independent women. It's great, right? But if you're so independent that you find it difficult to accept help, so there's nothing wrong with being independent. It's good. But if you're independent and you realize that I need help in these areas, I'm not perfect in everything, so I need someone to help me out in these areas, you're not flexible like that, then it could suggest something wrong with your sense of self. Because people who are that way, the reason they don't reach out to get help is because they feel like if I reach out for help, then people will know that I can't help myself, that I'm not altogether put together. So it's still that mask we talked about where people are living to live, they act to fit.
To meet a standard.
Exactly. They act to fit the expectation of the person they're acting for. So they lose their sense of who they are. They're not authentic anymore, because when I'm with you, I live up to Julia's expectation. When I'm with them, I live up to their expectations. At the end of the day, I don't really know who I am, do I? So people that have a sense of low self-esteem, they do things to please other people. So another characteristic, you're people-pleasing all the time. And there's nothing wrong with people pleasing if you love the person and this is your special person and you want to bend over backward. But when it's something that is for everyone, you can't say no, even when you know your schedule is tight. You have things to do. And as you're saying yes, you're thinking, oh my God, how am I going to get this done? And you can't help it, even though you don't want to, then that's a sign that you are fishing for approval and validation. So the people pleasing is like me, accept me, I respect me, because you don't have that for yourself. Another telltale sign of low self-esteem is when you're over apologizing. There's nothing wrong with apologizing. So these are normal behaviors that are acceptable, but when it goes overboard, it's an indication that something is not secure within. So over apologizing for things that you're not responsible for, things that are not your fault, then it's also suggests a low self-esteem. For example, maybe I have a role to play, I have a presentation to give, and for some reason I maybe forget what I'm saying or trip over my words. If you apologize once, it's okay, but where you feel, oh, I'm sorry, and I'm sorry, anything, I'm sorry, I'm sorry. Some people even apologize for being there, and and even beyond what they say on the apology, sometimes your body language says a lot as well. When you're shrinking and you're it's almost like you're apologizing for existing. So that attitude suggests low self-esteem.
For telltale signs of high fragile, because I would assume it's not easy to spot. From the explanations you gave, I could easily tell when a person is withdrawn, a person is more like, oh, I don't fit in, or a person constantly says, I'm not beautiful enough. But a person with high self-esteem and then is fragile would maybe not do all of that, but still has a self-esteem issue. So what are telltale signs for a person with high fragile self-esteem?
Self-esteem. All right. So being overly defensive, meaning you can't take simple feedback. You make it about you. So, you attack, you flare up, you're reactive, you're upset, like making a mountain out of a molehill because someone is trying to give you criticism. And the reason is because it reflects on your sense of self. And remember, having a fragile high means externally, you look like you play the part, you look the part, you act the part. But inside, and people can't see that, you fear that you really aren't all that. And so when anything so much as suggests that you're not all that, you're quick to defend it. But if you have a stable, secure, high self-esteem, you're able to really look at yourself and whatever it is that is criticized or the feedback that is given, and be able to accept, oh yeah, I did make a mistake in this. Oh yeah, you're actually right. Because what you have done does not reflect on yourself. So another telltale sign of high fragile sense of self-esteem is if you feel like you have to be better than other people in order to matter. You always have to win the competition, win the argument, bring other people down. Yeah. It is suggestive of the fact that inside you feel better when you do this because you don't feel like you belong or you're enough. So it's almost like when your defenses are so high, it's because there's a vulnerable interior that you want to hide. But when your defenses are low, it's because, well, this is me. I have nothing to hide. I believe in myself. You see the difference? Yeah. So the exterior, the exterior that people that have high self-esteem, high fragile self-esteem build is suggestive of the fragile interior. Because if you're going to get so upset about the small thing or this, feedback I've given you, then it suggests that, it reminds you, or it's a hint or suggestive that behind all that facade, externals, there is an interior that is feeling or afraid that they're not worthwhile actually, or they're not good enough actually.
So the next question is, for people, because you've already educated us or taught us how we can identify or how a person too can identify in himself low self-esteem or high fragile self-esteem. So what practical steps can we take to improve our self-esteem? Either at this point, I don't want to like tell people
Yeah.
asking just because I feel like the high fragile self-esteem is very sensitive because we have a lot of them. In short, I feel like most of them turn out to be bullies because most of the times they're the ones.
I agree with you completely. In fact, you just reminded me of a patient of mine. And so she had low self-esteem. She was depressed, actually. And she was bullied as a child. And the belief that caused her to really go into depression that we had to work on in therapy was this idea that I deserved to be bullied because I actually was ugly. So she blamed herself for the treatment the bullies meted out to her. So we had to look at this idea and say, okay, so you believe that, you deserve this bullying. You were bullied because you were not beautiful. And so you deserved it, kind of. And she said, yes, I do believe that. And these are not things people say to themselves logically. These are really like subconscious beliefs. So when we looked at the belief and we were fact checking it and seeing what was factual and what was a negative opinion, we'll realize that people who they bully because they have the feeling that they need to bring other people down in order to be enough, which is what you're saying. So they're bullying not because of you, it's because of them. And then I asked her, so are you saying to me that everyone has said to you that you're really ugly? She was like, no, actually quite a lot of people compliment me. I'm like, okay, so are they all lying? She was like, she doesn't think they would lie, that these are random people. So I'm like, okay, so if people actually compliment that you're pretty and this thing still happened to you, what do you think that means? Was it because you were ugly? Or did this behavior say something about the person who bullied you? So through questions like that, we call them Socratic questions, we're able to help her understand that the action of the bullies, the behavior of bullying was because of the bully, not because of her. So what you just said is very important, that people who have fragile high self-esteem, they do these things to shore up or buffer up or hold up their self-esteem because it's low.
And people don't feel sorry for them. So we tend to want to get help for people who have low self-esteem and then leave out the people who actually suffering too, but because they have a mask, we can't really try to like help. So we tend to want to direct all the help to people with low self-esteem. So for people who are listening, I'm sure they can talk to themselves, and people around them can also identify, just because you've of course explained how can they improve their self-esteem. Maybe we'll take one today, and then next we begin with
the people with low self-esteem.
Yeah.
All right. So I love the way you broke it up, just so that it's very clear to our audience. All right. So people that have high fragile sense of self. First of all, I want to point out that they're typically not even aware that they do that. In fact, a hallmark of someone with high fragile sense of self-esteem is that they blame everybody else. It's everybody else is stupid, incapable, not. So I have this picture of these are the type A personalities. Of course, not. I'm not generalizing. It's a stereotype. It doesn't mean that every type A personality has high fragile, but it's one of the ways we see them. Some of the professions, they're typically the bosses, right? So they don't believe that there's anything wrong with them. So they don't see this. So the first step would be, if it is affecting something important to you, if it is affecting your life in such a way that your people that you care about are being affected, talking about those that have high fragile sense of self, or your relationships are being affected. Because imagine marrying someone like that, where you're constantly put down to make them feel good. So it typically would affect relationships all the time. It typically would affect even like work relationships. So it is these work relationships and these intimate relationships, difficulties with these areas, that brings these people in. So if you find yourself having these issues, then you might want to, come for professional help and have yourself screened and checked out and helped. So, but besides that, we handle this unconscious low self-esteem the way we handle low self-esteem. But the difference is that you first have to bring it to their awareness and point out why they do these things, because the mask they're wearing and the belittling other people, feeling superior, these are coping strategies to protect vulnerable, soft, low self-esteem that is inside. So we first need to point out that you do these things because of this. And then once they are aware and they're understanding, then we treat the low self-esteem the way we treat other low self-esteem, which is we go to the roots, we look at what is the experience you've had that makes you feel like you're truly not worthy. And a lot of times it dates all the way back to upbringing, some experience that happened when they were growing up. And it will amaze you how many evidences or proofs that people have experienced that make them show them over and over that you're not good enough. Forget about the prizes you win. Everybody thinks. So this is like the kind of narrative that goes on in their mind. Everybody thinks you're good enough, but you and I both know that you aren't worth nothing, something like that. So it's a painful way to live. And you can imagine why, if you think that way about yourself, you'd want to really buffer up the exterior and say, no, I am worthwhile, and then on all that. So we would identify the life experience. I actually had a patient that we had this conversation, and it went all the way back to when she was in primary school, and she come back with an A, and her mom would say, or come back with a B, and her mom would say, well, those that had an A didn't have two heads, now did they? In other words, a B is not good enough. And then to experiences where she remembers being promised a gift if she got a certain grade in school, primary school. And this person I'm talking about is in early 30s. So many years ago. These are over and over experiences that tell you that you're not good enough. Go get those degrees, go get whatever you like, but we know that you are not good enough. So she was promised a gift if she had got a certain grade in her academics, and she got the grade. And then when she presents her mom with this thing that she has done, mom is like, dismisses it. I'm like, things are important. I can't buy this thing for you that I promised I would. I have a lot of things on my mind right now. And that told her that no matter what I do, I will never be enough to her. So that was the beginning. So we go to the root, and then we look at these beliefs so your mom's or your dad's, you believe that because they acted this way and they did this, it means that you're not enough. Could it be as a result of something else? Could it be that maybe they were stressed when they said that? Could it be that it wasn't about your worth as a person, it was about what they were going through? And the reason they couldn't get you what they promised to get you was because maybe they couldn't afford it at the time, and they were angry with themselves that they couldn't afford it. Parents, we have a way of, transferring anger sometimes. Not helpful, of course, to our kids. So we looked at this thought, and so looking at beliefs, and that was what helped her realize that statement meant more about her mom than it did about who she was. And that the fact that not only her achievements and not only the things she had done, but the fact that she was who she was. And I love to mention to those who are spiritual that you're created in God's image. That is what makes you worthwhile. The fact that you are not like an animal, or you're not like a worm or an insect. You are a human being. You are worthwhile regardless of your achievements. So whether you achieve, it's great to achieve, but even if you don't achieve, and for this particular patient I'm talking about, what I reminded her was, so she's married, and I said, is your husband with you because of how great you are at work? He's proud of my achievement, but no. Okay, so are you at work, at home, always talking about how you did this well and you did that well? And she was like, no, sometimes we sit and we say nothing. I'm like, okay, and is that time enjoyable where you sit and say nothing with each other? Like, yeah, I love him, he loves me. So there must be something more about you other than your achievements. So could that perhaps mean that you are worth more than your achievements? She was like, yes. I'm like, okay, so if you're worth more without your achievements, what is it that is worthwhile? She was like, who I am, my talents, my potential, my abilities, the way I am, like my uniqueness. Exactly. And we're all unique, aren't we? We all have talents, we have abilities, we have, different things that make us worthwhile as people, regardless of what we do and what we bring to the world. So these are some of the ways we address that in this person. So for those that have high fragile sense of self, just in summary, I would first point that out and show them that the things they do are coping strategies to protect themselves against that fear of having that low self-esteem, and then all the other things I said.
All right. Thank you so much, ma. It's quite an enlightening time. Thank you so much, ma. Our time is up for today's session. So I would say what I often say, please, if you fall into any of these categories, please do well to see a professional. You'll do well to visit us here at Diff Medical Center Sunshine Clinic. She's certified. She will attend to you and she will attend to you, give you care that is tailored to your needs, I promise you. If you have questions, please, there'll be an email on the screen. Send them there. Ask your questions. We'll do well to get back to you. And on our next episode, we'll have more discussions on these same topics, self-esteem. So do well to like, follow, and watch till the end. Thank you.
Thank you.